4-0 Texas on top, and we visit with Jim O'Connell, for the president of the Boston Healthcare for the Homeless Program, and Bob Taube, who's the executive director of the Boston Healthcare for Homeless Program. And we've talked so much about Socks for Socks and a great program starting this season. Well, guys, thank you for joining us here tonight. And so far, a tough night here rain-wise for you guys. But tell us a little bit about your program, what you guys do.
Sure. We're the Boston Healthcare for the Homeless Program, and we are a bunch of doctors and nurses and nurse practitioners who work out of several hospitals and go out to take care of homeless people in about 70 shelters around town, out on the streets, under the bridges.
I hope this is not a dumb question, but why the White Sox?
You know, it's not a dumb question at all, Jerry. White Sox actually are really very much a part of our care. We spend several $1,000s a year spending on socks, and it turns out homeless people walk around a lot. They get a lot of wounds on their feet. They get athlete's foot. They get blisters, sores, and they can turn into real bad infections. We have a lot of people with diabetes, and White Sox turn out to be really important for us.
And how can people help in this crusade?
Well, we really appreciate what the Red Sox Foundation in Neston has done. It's very easy to help. For folks who are coming to the games Saturday and Sunday, if they just bring socks, they can leave them in boxes at any of the entrances. There's a drawing on Sunday for really swell prizes.
Well, Matt Clement here apparently has injured himself, and certainly the footing on the mound, Jerry, has really been bad here in the rain falling.
Yeah, that's the concern, obviously, and we don't know exactly what happened to Clement. Obviously, they're going to do some work on the mound right now and around home plate as this rain continues to fall at Fenway Park, and this is what you deal with. And, of course, anytime it becomes slippery out there for a pitcher or the hitter, immediately you'll see the ground crew come out to try to doctor the area. Now, here's the last pitch by Clement. Looks like he turns an ankle a little bit as he jumped toward the end of that pitch. Immediately that brought Terry Francona and Jim Rowe out of the Red Sox dugout, and they'll try to work on that area around the rubber, excuse me.
Jim, you guys have embarked on a capital campaign also. Can you tell us a little bit about that?
Sure can. We're really excited. It's the first thing we've ever done in our 22 years of existence, and it's the old city morgue, believe it or not, is available down right across the street, right across from the emergency room at Boston Medical Center. And we hope to bring our respite unit, which is a 90-bed sort of step-down hospital down there, and move our big clinic across the street so we can have a real comprehensive approach to taking care of people.
You know, it's hard to put a number on it, but homeless, I mean, you know, there's so many out there that don't really go recognized. I mean, you know, it's hard to just put a number on how many people are out there. I mean, you see it, you hear about it, but yeah, on the other hand, there are a lot that you just don't know about. You know, we see in the wintertime when the weather's cold, going around town trying to get people indoors and stuff like that, but it's certainly hard to monitor, isn't it, from day to day?
It is hard. The city of Boston does an annual one-night count in December. And on that night, typically we find about 6,000 people who are in shelters or out on the streets. If you count people who are also doubled up because they've lost their place to live and they're just doubling up with family or friends temporarily, and you look over the course of the year, it's probably closer to 20,000 people who at one time or another are homeless in Boston.
And unfortunately, I think a lot of people forget about it in the warm winter months. You know, we hear about it so much in the winter time, but now's the time to do something about it.
This is exactly the right time to do about it. It's actually really dangerous out there when it gets really hot, and so we're thrilled to have a chance to be able to sort of signal it to people how important it is.
Well, gentlemen, thank you for joining us, and a great program. Thank you again. Nice to meet you both.
Well, thank you very much. We appreciate it. I hope the rain stops.
We certainly do.
Well, with the score this way, maybe we hope it doesn't stop.
To go get to the fifth. That's right. Okay. Thanks a bunch, you guys.
Thank you, guys. Appreciate it.